Hey, fellow Facebook and Instagram peeps, welcome to Austin Dental Spa, and it is March 2nd, so you know what that means. It's Texas Independence. No, it is Texas Independence Day, but what March means is it's March Madness. And that's what we're celebrating at Austin Dental Spa this month, is a little bit of madness, but our March Madness is going to be madness about taking care of yourself, self-love, particularly your dental care, but we're probably not going to just stick to the oral cavity. We'll be discussing some other things, and in favor of March Madness, which is, if you're not a basketball fan, a college basketball fan, this may all be lost on you, but late in the month of March, the tournaments are about to start for the conference championships, and they'll narrow it down to 66 teams. There's a wild card playoff between the 65 and 66 teams that play into the 64 team tournament, and it's crazy for about 3 weekends, while each week half the teams are eliminated because it's single elimination. UT is projected to be a number 16 seed. There's 4 regions in the U.S., and it's very possible that if it plays out the way that they're projecting, UT will be playing Gonzaga, who is like one of the number 1 seeds and one of the top teams in the country every year. So UT may not be in the tournament for very long, but it is crazy because especially the number 5 and the number 12 seeds end up playing each other in the first round, and quite often there's not that much difference between those two teams, even though there is in the seeding, and the number 12 teams quite often beat the number 5 seeded teams, like 40% of the time. So it's a little fun if you're a competitive person, and being Austin Dental Spa that we're celebrating March Madness, we're going to set this up in our reception area for the month of March, and nothing to it. You get 3 of them in the hole, in any of the holes, and we've got a prize for you. It's as simple as that. And that was on first take, by the way. 2 50s and 100, one left-handed. So I still got it. Some days I still got it. Anyway, we're going to talk today. This was a very interesting study done at New York University in the dental school at New York University, where they studied smokers, which have long been known to have more dental problems and a higher incidence of oral cancer than non-smokers. But they didn't just have those 2 categories. This is the first study I've seen of its kind where they also studied 1/3 of the group was smokers, 1/3 of the group was non-smokers, and the other 1/3 of the group was vapors or e-cig users. And they tracked the microbiome in their mouth, which is the type of bacteria that live in their mouths, by using saliva samples over a 6-week period. And very interesting, they found that, of course, non-smokers were kind of the control group, but they've studied microbiome, or the bacteria that normally live in the mouth of non-smokers, for many years. We have bacteria tests that we can do here in the office. And we've always known that smokers tend to have a different microbiome, or different types of bacteria in their mouth than non-smokers. But they found yet again in the e-cig users, they found yet a different predominance of bacteria. And one of the significant findings was one of the main bacteria that they found an increase in vapors was Porphyromonas gingivalis, or that nasty P. gingivalis that we've brought up many times in Wisdom Wednesdays, because there's a direct association between P. gingivalis, which used to be only found in people with gum disease in the mouth, and now that they've started studying Alzheimer's patients for the last 20 or so years, after they donate their body to science, when they pass away, they found one center in the brain that has P. gingivalis. It's the only other place in the body that they found it. So we know there's a direct connection between Alzheimer's disease and P. gingivalis. We don't know what comes first, whether it starts developing in the brain and somehow gets from the mouth to the brain, or how it gets there. There are researchers way smarter than me studying that right now to this day. But we know that P. gingivalis is only found in high degrees in the mouth in people with gum disease. So the supposition from this study, and it's going to take a lot more studies of its kind, is that vaping, although it changes things from, and a lot of people, including my oldest son, think that vaping is healthier than cigarette smoking. And in some ways it might be, but in some ways they're finding that it might not be because of that heated vapor that's touching the mouth. It's changing the type of bacteria that want to grow there. And so neither smoking nor vaping are healthy for you, and they both have been proven to increase the chances of not only oral cancers, but also dry mouth and gum disease, and potentially higher incidence of decay. But now this P. gingivalis piece that New York University came out with is just one more reason to stop vaping if you're a vapor, especially if you switch from smoking to vaping thinking that you were doing yourself some good. You're going to do yourself a lot more good just to chew Nicorette of gum or something like that and stop smoking. Or Chantix is a wonderful drug out there that we've had couples that I gave Chantix to because the wife wanted to quit and the husband said, I'll take it with you, but I'm not going to quit smoking. And he lost the desire to smoke just from taking the Chantix for a week. It comes in a little starter kit about a month long, and nearly everybody I've put on that, if they really wanted to smoke, and that's the reason they're doing it, they quit smoking. So it is a very effective drug, and it's still out there and inexpensive, like $150 for a month's supply for that intro kit. And then most people are done with it by the end of that first month. So that's my scientific portion for the day. I always do a health tip, and my health tip this week is avoid the foods that cause staining on your teeth, foods and beverages. This study says rinse your mouth with water after eating or drinking something that might stain your teeth. Not so much fun to rinse your mouth out after you've had a glass of red wine, but anyway, I understand the concept. Use a straw when drinking cold drinks like cola or juice that might stain your teeth. This is a good one, chewing gum that contains xylitol. We've been talking about xylitol off and on for ever since the virus pandemic started, because they found early on there is a nasal spray called Xlear, Xlear, that the FDA leaned on some pressure because it has xylitol in it so that it smells and tastes in the back of your throat sweet, but they found out that xylitol keeps the SARS-CoV virus from getting into the ACE2 receptors in your nose and the back of your throat. And so it started getting promoted on all these websites as being a potential treatment to keep from getting COVID. And the company didn't do that. They weren't claiming that. Other websites were. And the FDA leaned on this company and they said, hey, we're just making a nasal spray. We aren't claiming this stuff, but it did work. And I reported that on a Wisdom Wednesday over a year ago. So it's still out there. You can order it on Amazon. It comes in four canisters and cheap. And it actually tastes pretty good when you squirt it up your nose. It ends up in the back of your throat. And hey, if it helps keep the cancer or the virus from getting into your bloodstream, all the more better. And lastly, eat plenty of crunchy fruits and vegetables, apples, carrots, celery, because they boost your saliva, they scrub your teeth just from the friction, and they act as natural stain removers. So that's my bit for Wisdom Wednesday, for the first Wisdom Wednesday in March. I'll look forward to bringing you more healthy tips, and we'll talk about the basketball tournament together, and we'll shoot some more hoops. And I'll see you next week for another version of March Madness Wisdom Wednesday.